you're a nursing student and you are feeling anxious and unprepared for your upcoming OSCE, sit tight because this video is for you. Hi everyone, welcome back to my channel. If you're new here, hi, my name is Charlotte. I'm a registered nurse and today I am super excited because I'm going to be sharing with you all of my OSCE preparation advice and tips, as well as my OSCE exam footage. This is just so that you can kind of see what I did, what to expect from an OSCE exam, and also if you would do anything differently, then you can pick up on that and kind of tailor it to what suits you. A big thank you to Abifako7334 for suggesting this video, and if you have any videos that you would like me to make, then please put your suggestions down in the comments below. Before we get into everything, don't forget to like, subscribe, do all of that good stuff, but for now, let's dive right in. So my OSCE was back in my first year of nursing school at AUT in 2021, and I remember feeling very anxious and nervous and apprehensive about it. I had a really difficult time taking pulses and also with blood pressure because I didn't trust myself to know what I was feeling or hearing, and I always just doubted myself. So I completely understand all of the nerves and apprehension that you may be feeling currently. So my OSCE was in second semester and it was on hand hygiene, vital signs and CPR. My OSCE was also a little bit different because in my first year of nursing school we were kind of still in the thick of all of the COVID lockdowns. So my OSCE was different because I actually did it at home during the middle of a lockdown and we had to film it, so it was very different from what we had been preparing for. All throughout my second semester we were in person at uni, no lockdowns. It was really great, and so we were preparing for our OSCE like we were going to be doing it in person, and then about a week or two before the actual exam we went into this big lockdown and ended up having the plans changed so that we had to do it online. I ended up doing it at home. I used my dad as my lab partner to do my exam on, and we filmed it and then sent it in. So my OSCE was a little bit different from how other people's OSCEs and how OSCEs should be done, but I guess a positive about it being in lockdown and being at home was that I got to film it, and so I have the footage to be able to show you my real OSCE and what I did. Not the best circumstance, but finding a silver lining. So with your OSCE, if it is in person, then your clinical tutor will be doing some of the skills alongside you to make sure that you're doing it accurately. So for things like your pulse checks, they will be doing one wrist while you do the other. For blood pressure, they will use a dual stethoscope so they can hear exactly what you're hearing, and with respiratory rate, they will be counting the breaths at the same time as you. And I think it's really good to know this beforehand because it just means that you're more prepared, and on the day there's less surprises and you'll feel a little bit more confident. So on to my best advice. My first tip is that you should be practicing as much as you possibly can at home. Practice on your friends, practice on your family. There are some skills like with pulse and also respirate and temperature which you can practice on yourself. Also, the more you practice, the better you'll be anyway. And also if you can practice on lots of different people, that's also great because as we know, everybody is slightly different, and so some people will have faster heart rates, some people have irregular heart rates, some people's blood pressure will be higher or lower. It's good just to have the practice on a variety of different people so that you're as prepared as possible. My second tip is, and this is one that I did that I found really helpful, is to make a list of rationales. Why are you doing what you're doing? For my OSCE, we had to explain the rationale for taking a pulse, for taking a blood pressure, taking a temperature. It wasn't just about if we could do the skill properly, it was also about whether we knew why we were doing it. So for me, I found it really helpful to make a little Google sheet or a Google document, and I would put the skill on the left-hand side and then the reason for why I was doing it on the right. And I just practiced reading and repeating this over and over again so that on the day I was able just to say it without having to think too much. It saved a lot of time. It made me feel more confident. So if you can do that, I would really recommend it. My third tip is if your nursing school has a CPR lab or CPR dummies, I would really recommend booking a time to go into the lab by yourself and just practicing the CPR. AUT has a CPR lab which you can book online. You get a 30-minute slot, which is actually heaps and heaps of time to practice CPR. All of our dummies had the little tablets which showed you the percentage percentage of how well you were doing, as well as giving you some feedback on things to work on. So if you can book a CPR lab, I really recommend doing it, because on the day you want to just be able to do it without thinking, without worrying so much, you know, that you've got the right pace, the right rhythm, the right depth. You want to know that you're just gonna go in
and it's done.
Booking a CPR lab was very helpful for me. I would maybe do at least 2 before your actual exam, just so that at least you've got that practice that wasn't just in your lab class. My 4th tip is to practice what you're going to say. I practiced this in front of the mirror at home when I was getting ready. I would practice it just as I was going about my daily business. As I say, it's just really good to have that preparation so that you feel confident, you know what you're going to say, you don't have to think too much about it, and it just kind of takes some of that stress off. Because on the day you can't bring anything in with you, so I just had the script as my practice beforehand, and then on the day I just felt a little bit less stressed because I knew what I was going to say. I had practiced it heaps of times, and I felt like it really helped. My 5th tip is to do at least 1 full practice run before the big day. So that means sitting down with your lab partner, a friend, family member, whoever it may be, and going through the whole thing top to bottom and making sure that you have everything as you want it, as works for you, and that you know if there are any areas that you need to work on, any areas which you're feeling a little bit less confident in. And it also just means that you kind of have an idea of how much time it's going to take you as well, whether you're in the time limit, if your school has a time limit. And as I say, preparation is the key to success, because it makes you more confident, you're more prepared, and you'll just feel a lot less stressed and anxious on the day as well. If you can do more than 1 full practice, the better. On the day before you go in, don't try and study, because you're not going to remember anything, your brain's not going to absorb that information. The best thing that you can do is focus on soothing yourself, calming any nerves you have, and the best way that you can do that is by practicing some deep breathing. I really like the box breathing method, so it's where you take a deep breath in for 4 to 6 seconds, and then you hold it for the same amount of time, and then you exhale for the same amount of time, hold it for the same amount of time, and then repeat. So it's kind of like a box. I found that really helpful, and it just really helped calm me down a lot as well. So any breathing technique that works for you is my 6th tip. My 7th tip is to trust yourself, especially with what you are feeling and what you are seeing. And I mention this because this was the thing that I was really stressed about, because I always doubted myself and what I was hearing. With pulse, you just have to remember some people are going to have an irregular heart rhythm. If you miss a beat, it might just be the actual heart rate and their heart rhythm. Blood pressure, some people are going to have low or high blood pressure. Just because we're expecting to hear it around the 120 and 80 mark doesn't mean it actually will be there. You're not going crazy, I promise. Some people just have different blood pressures. So trust yourself and what you're hearing and what you're feeling, and that is the key to success. My next tip is to take your time on each skill. Make sure that you've gone through everything, you've said everything that you needed to say, you've demonstrated all of the parts of the skill that you need to. Obviously, there are some skills like the CPR which have a time limit, which is why the preparation beforehand is really important, so that you can get it done within the time, you know how long it's going to take you, all of that good stuff. But for the other skills like the pulse, blood pressure, just make sure that you're taking the time. If you feel like you need to restart or redo it, just let your clinical tutor know, I missed the beat or I stopped counting, can we do that again please? Take a deep breath and then redo the skill, because it is better for you to redo it instead of panicking and taking a guess that's then wrong. So take your time, make sure that you've gotten through everything that you want to get through, and then move on to the next skill. My last tip is for the worst case scenario. This won't happen to you, but on the chance that you've had a bad day, something's gone wrong, and you end up not passing your OSCE, don't panic, because you can reset it. So just take a deep breath again. Love those breathing techniques. Just pretend it was a practice run. I feel like sometimes disassociating from the reality of the situation does help a little bit. So just pretend it was just a practice run. Use the feedback that you got from your clinical educator and your tutors. Use that feedback to kind of guide what you work on, what you practice the most, and then go into your redo with that extra confidence, knowing that you've done everything you can, you've practiced what you needed to practice, and you'll pass. So now that we have gone through all of my advice, I feel a bit nervous about sharing this with you because it was my exam and I was quite anxious on the day, and obviously it wasn't the ideal situation because it was in a lockdown and we were filming it, but this is my OSCE that I did in 2021. I have come such a long way since then, like now fine with taking pulses, fine with blood pressure, I don't feel anxious about doing them anymore, and just have come a long way since my first year of nursing school. So this is my OSCE. I hope you guys enjoy. Also featuring my dad, so shout out to Dad for stepping in and being my lab partner. Yeah, enjoy. Hi there, my name is Charlotte. My student ID number is 20117967, and this is my practical assessment for Introduction to Nursing. So I'm going to begin my practical assessment by going through Doctors ABCD, which is an acronym that we use during basic life support. So in an emergency situation, the first thing that you want to do is look for dangers. So these are dangers to both yourself and to the patient. In a non-clinical situation, dangers could include things like fires, electrical wires, water and traffic, and in a hospital setting this could include things like clutter and bed rails being left down. So you just want to make sure that you and your patient are going to be as safe as possible. After you've checked for danger, you want to move on to checking how responsive your patient is. So first off, you're going to verbally acknowledge them and see if they respond to your voice. So you want to call out their name and ask if they can hear you. You want to make sure that your voice is quite clear and very loud so they can respond to you. So you will go like, "Mr. Smith, can you hear me? Mr. Smith, can you hear me?" And if they don't respond to your voice, you want to move on to initiating a pain response, seeing if they respond to pain. So how we do this is we do a trapezius pinch. You just pinch their shoulder muscle and it should initiate a pain response. With newborn babies, you can also flick the bottom of their feet. If they don't respond to the pain stimulus, then you need to move on to S, which is send for help. So if you're not in hospital, you want to get a bystander and send them off to call 111 and get an ambulance, and you also want to send another bystander off to get a defibrillator. If you're in a hospital setting, you want to press the emergency call button so you can get other healthcare professionals to help you. Once you've sent for help, you want to move on to A for airways. So you're going to check your patient's airways to see if there's any obstructions. You do this by tilting their head back, getting their jaw open in a pistol grip, and just checking to see if their airways are blocked. If they are blocked and you can safely remove the obstruction without pushing it farther down the airway, then you should do so. After checking the airways, you want to check their breathing, and we do this by hovering your head over their face and tilting your face down towards their chest. The reason why we do this is so that you can feel their breath on your face and also listen for breath sounds, and you tilt your face towards their chest so that you can watch for a full inspiration and expiration. You're going to watch their chest for 10 seconds, and if you don't see a full rise and fall of their chest in those 10 seconds, you need to move on to CPR. CPR is the C in Doctors ABCD, and the rate for CPR is 100 to 120 compressions per minute, the ratio being 30 compressions to 2 breaths. So with the breaths, you're going to tilt their head back, pinch their nose so that no air that you breathe into them escapes through their nose, and you're going to tilt their jaw open with a pistol grip, and then breathe gently into their lungs. With the compressions, you want to keep your arms straight with your hands interlocked like so. Place the palm of your hand on the center of their chest, and you want to try and press down 1/3 of the depth of your patient's chest. And you want to try and refrain from your arms bending and from bouncing. During CPR, you also should apply step D, which is defibrillator. So in your non-clinical setting, once someone has brought the defibrillator for you, get them to open up the defibrillator and put the pads on. In a hospital situation, someone will bring a defibrillator with them. And what you're going to do is you open up the defibrillator, listen to the voice prompts, and place the pads either on their front and their side, or on their front and their back, depending on how large your patient is. Follow the voice prompts and the defibrillator will administer shocks to help restart their heart if necessary. So now that I've done the doctor's ABCD portion of this assessment, I'm going to move on to hand hygiene and the practical assessment. So I'm going to wash my hands for 40 to 60 seconds using lukewarm water. So I'm going to start now. So first I'm going to wet my hands, and then using liquid soap, lather my hands fully. Then I'm going to get the backs of my hands and then the fronts as well. I'm going to do my thumbs, my finger pads, getting underneath the nail beds, on both hands as well. You don't want to neglect one hand. And then in the knuckles and my wrists. And then once your hands are fully lathered, you want to wash off all the water, all the soap, with the lukewarm water. Once all of the soap suds off, turn the tap off with your elbow and use paper towels to dry your hands. It's really, really important that all of your hands are dry because wet surfaces are breeding grounds for germs. So you want to get in between the fingers and just make sure everything's clean. And hand hygiene is really, really important for infection control to minimize cross-contamination and minimize you spreading germs to your patient and to their support system. Now that I've finished the hand hygiene part of my assessment, I'm going to move on to cleaning my equipment before I see my patient. So I'm using antibacterial wipes, and I'm first going to clean down all of my surfaces. I've got 2 trays. One of these trays will be for my clean equipment. The other tray will be used for the used equipment. And the reason why I've got 2 trays is to prevent cross-contamination between the used equipment and the unused equipment. So I'm just making sure I'm getting everything. My bin is also just here. I'm making sure that I'm getting into all of the corners, the handles as well. And the bottom. It's really important that we clean the equipment because, especially in a hospital situation, you may not always be using your own equipment, so you don't know if the equipment has been cleaned previously. So it's always good just to clean everything before you go see your patient to prevent cross-contamination of germs from staff, other patients, and yourself onto your patient. With my thermometer, I have run out of the plastic sheaths. So what I'm doing is I'm cleaning the thermometer thoroughly before and after I use it. In a normal situation, a hospital situation, I would just use the plastic sheaths. With my equipment, I'm making sure to clean every part of it, but especially the parts of the equipment which I'm going to be touching and will be touching my patient. the blood pressure cuffs can be a little bit fiddly. Sometimes they take a little while. So now that I have cleaned my equipment, I am now going to go and see my patient. Hi Ben. So my name is Charlotte and I'm a student nurse going to look after you today. Before we begin, can I just get you to confirm your son? And is there anything that you'd like me to call you?
No.
Just Kai? So today we're going to be doing a vital signs assessment, so that involves me taking your temperature, pulse, respiratory rate and blood pressure. Is that alright with you?
Thank you, miss.
Good. And before we begin, I just wanted to let you know that any information that you share with me will remain completely confidential unless I have to share it with the doctor, and it may also go into your health records. Is that alright?
Yes, thanks.
And if you want me to stop at any time or you feel uncomfortable, let me know and we can stop and
Thank you.
do you have any questions before we begin?
No.
So I'm going to start with a pain assessment because I heard that you're in a bit of pain. Could you first point out to me where you're feeling discomfort?
On the elbow.
So in your right elbow.
Yes.
Okay. And in your own words, how would you describe how this pain feels?
It's a dull throbbing.
Okay, dull throbbing pain in your right elbow. And does anything make this pain better or worse?
Paracetamol makes it better.
Okay, so have you had any paracetamol?
Just the one.
And when did you take that?
An hour ago.
An hour ago, okay. And does your pain radiate anywhere?
It radiates to the middle here.
So it runs like down your arm towards
Yes.
your hand. Okay, I'm sorry, that sounds quite uncomfortable for you. So we'll get that sorted a bit later. So in your own, on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain you have ever felt in your life, how would you rate your pain?
It would be 4.
4, and with the paracetamol, does that change?
That's 4 now with the paracetamol. It was maybe 5 before.
Okay, cool. I'm sorry, that also sounds really uncomfortable. So, do you know maybe what caused the pain?
I think I knocked it about 3 hours ago.
I was just about to ask, do you know like how long has this pain been going
Yes.
on? It's about 3 hours.
Yep.
Okay, cool. So I'll document all of that and we'll get a doctor and later to see you. So
Okay.
if it's alright with you, I'd like to move on to the vital signs.
Yep.
So the first thing I'm going to do is take your temperature. I'm taking an oral temperature. So this just goes underneath your tongue and you just hold it, hold your mouth closed.
Yep.
So, and you can hold the thermometer if that makes it easier. The reason why we take a temperature is to rule out hypothermia, which is low body temperature, and hyperthermia, which is high body temperature, and hyperthermia can be a sign of infection or fever. We're taking an oral temperature today, but you can also take a rectal temperature, an axillary temperature, and a tympanic temperature. Thank you. So I'm just going to show the camera. Mr. Body's temperature is 36.3 degrees Celsius. Okay. So your temperature was 36.3 degrees Celsius, which is within our normal parameters of 36 to 38 degrees Celsius. So that's all good. The next thing I'd like to do is take your pulse. So this involves me touching your wrist. Is that alright with you?
Yes.
I'm just going to put this underneath your arm. This is the patient's own pillow. In a hospital situation, I would clean the pillow, but because this is the patient's, I haven't cleaned it. So I'm going to take his radial pulse for 60 seconds. Is it alright if I touch your wrist?
Sure.
Sorry if my hands are a bit cold. Okay, so I'm going to start timing now. So for your pulse, I counted 69 beats per minute, which is within our normal parameters of 60 to 100 beats per minute. I would also describe your pulse as strong and regular.
Thank you.
So the reason why we take your pulse is to first rule out signs of tachycardia, which is a high heart rate, and also bradycardia, which is a low heart rate. And overall, it's just to assess your heart function and to make sure that your heart is pumping enough blood around your body. Okay, so the next thing I want to do is assess your respiratory rate. So I'm just going to assess your chest for 60 seconds. So I'm just going to sit to the side of him so I can see his chest side on. Okay, and I'm going to start timing 60 seconds now. Sorry, I'm going to start timing 60 seconds now. Okay, so I counted 14 breaths per minute, which is within our normal parameters of 12 to 20 breaths per minute. And I would describe your respiratory rate as regular and strong or normal.
Thank you.
The reason why we take your respiratory rate is to assess your lung function, to make sure that your lungs are taking in enough oxygen so that your muscles and tissues can get the oxygen and work properly. Okay, so the last thing I'm going to do is take your blood pressure. So I'm going to be using the two-step method. Is there an arm that you prefer me to use?
This one here, yeah. My right hand.
Okay, and it does involve me putting a cuff around your arm, so is that all right?
Yeah.
So with the two-step method, I'm first going to inflate the cuff and find his radial pulse and inflate the cuff up until I can't feel his radial pulse anymore. And that will give me an estimated systolic value. So first I'm going to find the brachial artery, the brachial pulse, by going diagonally from the thumb up to where his hook of his elbow is. Here we go. And then I'm going to line my blood pressure cuff up the artery triangle with his brachial pulse. And it's also important to make sure that your cuff is the right size for your patient and that it's nice and snug. So, if I just get you to hold that for me, please.
Thank you.
Next I'm going to find his radial pulse, and then I'll pump the cuff up until I can't feel his pulse anymore. So found the radial pulse. Is it alright if I proceed? So I could no longer feel his radial pulse at 130 millimeters of mercury. So now we're going to wait 30 seconds and then I'll take your blood pressures. If you just wiggle your hands, it will help you get some circulation back. For finding his blood pressure, I'm taking it manually, so I'll be using my stethoscope to listen to his blood pressure and inflating the cuff up. So, with the stethoscope ears facing forward, making sure that the diaphragm is on. And then this just goes flat against his brachial pulse. Okay. And making sure the cuff is just give it another couple seconds and then we'll proceed. Also, if it might be uncomfortable, but if it gets painful, just let me know and stop, okay? So because I couldn't feel the estimated systolic at 130 millimeters of mercury, I'm going to be pumping the cuff up to 160 millimeters of mercury. Okay, so I'm going to start, if that's alright with you. So your blood pressure was 118 millimeters of mercury systolic over 82 millimeters diastolic.
Excellent.
So 118 millimeters of mercury systolic over 82 millimeters diastolic. This is within our normal parameters of 90 to 140 millimeters of mercury systolic over 60 to 90 millimeters of mercury diastolic. The reason why we take your blood pressure is to assess your heart function again, this time to make sure that your heart is generating enough pressure to pump your blood around your body, and to rule out hypertension, which is high blood pressure and can be an indicator of a cardiac event such as stroke or heart attack, and also to rule out hypotension, which can be an indicator of dehydration or feeling faint. So thank you so much for letting me take your vital signs. Before we finish up, do you have any questions for me?
No, thank you very much.
Thank you very much.
Thank you.
So now that I have finished taking my patient's vital signs, I would then go off and document everything, but first I'm going to clean my equipment. So first, sanitizing my hands, making sure they're very, very clean. And then using the antibacterial wipes again. I'm going to first wipe down this tray. Again, it's important to make sure that you're cleaning your equipment after you use it as well, because again, if you're in a hospital situation, the equipment isn't always yours, so it's always disrespectful for your colleagues and for their patients that you clean everything afterwards. And also, it just is an important part of infection control, in that any germs that you've put onto it or that your patients put onto it can be removed before the next patient uses it. It prevents cross-contamination between different patients and staff. You want to make sure you get all of the little bits. And after you've cleaned your equipment, you want to put it back one by one into its rightful place. With your oral thermometer, you also want to clean the case for it, because you don't want a dirty case when you're putting your clean thermometer back into that. So that was my vital signs and Doctor's ABCD practical assessment. Thank you so much for your time and your attention. So that was my OSCE footage, and also my top tips and tricks. So I really hope that was helpful and enlightening. If you have any OSCE advice, you've done your OSCE and you have some tips and tricks, then please put them into the comments below, because sharing is caring and we want to lift each other up on our nursing journeys. Don't forget to like, subscribe, do all that good stuff. I will see you next Monday with a new video, but until then, have a lovely day and a fabulous week. Bye!